One day, there was a man and a woman who's ready to take their relationship to the next level and decided to engage in a sexual intercourse. As the weeks passed by, the man started to notice himself of rapid weight loss and recurring fever or night sweats and red rashes on his body. He was so terrified and he doesn't know what to do. He feels indisposed, so he decided to get consult from the doctor. He was tested, and as the results comes by, the doctor said he has STD.
So what is an STD? STDs are infections that are passed from one person to another through sexual contact. The organisms that cause sexually transmitted diseases may pass from person to person in blood, semen, or vaginal and other bodily fluids. Examples of STDs are chlamydia, gonorrhea, some forms of hepatitis, syphilis, and etc. Any diseases that are transmitted through sexual contact are considered as STDs.
So what are the symptoms of STDs? Almost all people develop antibodies within 2 to 12 weeks. But according to studies, other people's symptoms show up after 6 months of the contact. But by then, the illness is more complicated. People with STDs may have symptoms in the very beginning of their infection, like swollen glands, fever, headaches, and muscle soreness. Some of the more advanced symptoms are rapid weight loss, recurring fever or profuse night sweats, extreme and unexplained tiredness, and etc. Once we feel something is off about our body, it is best to seek medical attention immediately so that we can treat it as early as possible.
Is there a cure for STDs? Bacterial STDs can be cured with antibiotics if treatment begins early enough. Viral STDs cannot be cured, but you can manage symptoms with medications. There is a vaccine against hepatitis B, but it will not help you if you already have the disease. If you are given an antibiotic to treat an STD, it is important that you take the entire drug prescribed to you, even the symptoms go away. Also, do not take someone else's medication to treat your infection. It may take it more difficult to treat.
What can I do to prevent getting STDs and HIV? The only 100% effective way to avoid STDs is not to have vaginal, anal, or oral sex. If you are sexually active, you can do the following things to lower your chances of getting STDs and HIV. Choose less risky sex activities, use a new condom from start to finish, reduce the number of people whom you have sex with, have an honest and open talk with your healthcare provider, and ask whether you should be tested for STDs and HIV. Talk to your healthcare provider and find out if either pre-exposure prophylaxis or PrEP or post-exposure prophylaxis or PEP is a good option for you to prevent HIV infection.
How does STD becomes AIDS? HIV destroys CD4 T cells, white blood cells that play a large role in helping your body fight disease. The fewer CD4 T cells you have, the weaker your immune system becomes. AIDS can also be transferred by doing sexual activities, by sharing needles from blood transfusions, and etc.
Most children with HIV get the virus when it passes from the HIV positive mother to the child. This can occur during pregnancy, childbirth, or when breastfeeding. Only blood, semen, vaginal fluid, and breast milk have been shown to transmit infections to others.
Thus, we need to seek medical attention once we feel some of the symptoms that we mentioned.
So he followed all of his medication after that, which is why his condition didn't get worse. If test indicates that you have chlamydia or gonorrhea, or if you have been exposed to them, even though you might not have symptoms, you need to seek medical attention immediately to avoid spreading to other people.